Hello, this is Dr. Ron Clark. We're looking inside the knee joint with an arthroscope, a viewing scope which allows us to see the innermost parts of our knee joint. At the top of the screen is the knee cap. As the knee is bending, the kneecap is gliding gently over the center of the thigh bone. The knee is then straightened to allow the viewing scope to go along the outer edge of the knee joint towards the back where a tendon is visible. Bringing the scope towards the front of the knee, we then go along the outer edge of the knee towards the center of the joint. The center of the joint, the anterior cruciate ligament, is seen centrally in your photo. We now open the joint so that we can see between the thigh bone above and the shin bone below and the outer rim of the meniscus. And then pass the viewing scope towards the inside of the knee, and again open the joint to look at the joint surface and the meniscus, which can be seen between the joint surfaces. The joint telescope is moved along the inside edge of the knee, and a fold along the knee lining is visible.